All right, this is Mr. McMurray, and we're back on the female reproductive system. All right, so we talked about the biological clock, which basically once the estrogen levels drop and the female's body quits going through the menstrual cycle, preparing for pregnancy every month, then basically that's when she can no longer get pregnant. Okay, now when that happens, it's called menopause because you start stopping or pausing menstruation. And usually it starts for most women in their late 40s or the early 50s. But it can start even early 40s and it can go as late as the late 50s. There have occasionally been rare examples of women who are 60 years old or so that have gotten pregnant. But in general, usually from the 40s to 50s. All right. And the myometrium is the next layer. Myometrium, myo means muscle, so it's a muscle layer that causes contractions when the baby is delivered. When we talk about a woman who's pregnant, about to have a baby, and she has contractions, that's just the muscle we're talking about that starts contracting. Okay, and so that would be the myometrium, or the thick layer, muscle layer, if you will, of the uterus. All right, it is triggered by the hormone oxytocin. Okay, is a chemical that's released, and when it does that, then it starts the contractions, and we'll go ahead and start delivery. Now, we have taken that same hormone and we have used it to induce labor. Okay, if for example, when pregnancy has gone on too long, or perhaps the baby is getting too large to be delivered safely, we can induce pregnancy. Or sometimes because we want them to have the same birthday as their mom or their dad or someone else, okay? But oxytocin can be used to induce labor, okay, for various reasons. If for some reason we decide the baby needs to be delivered sooner than it would normally happen, then we can use that. And so when someone gets induced labor, that's what they're doing. They're using that same hormone that normally causes contractions to start them early. The perimetrium, the outside of the uterus, and so it's just the outer layer of the uterus that protects it. It would be part of the visceral peritoneum because it's around the organ in the abdominal pelvic cavity. So that would be called, but that's the perimetrium. Just like the perimeter means on the outside of something. So para means outside or around the outside. And so that's what that is. All right. Oops, didn't mean to do that. Hang on. Okay. So next is the cervix. Cervix is actually part of the uterus. It's the narrow neck at the bottom, and we usually use it for the opening as well. And it's the opening between the uterus and the vagina, so it connects the uterus to the vagina. All right. We talked about, this is dilation. That should just be dilation. But when a woman is pregnant, after the water is broke, then as the baby presses down on the cervix, it begins to soften and it begins to open. Okay, and this is a sign of how ready the baby is. You may have heard on to be delivered. You may have heard on like Grey's Anatomy or somewhere like that where they're delivering a baby and they say, oh, it's dilated so many centimeters. They're talking about the cervix. And generally around 9 or 10 to 11, somewhere in there is about when the baby will start being delivered. Say it crowns, which means the top of the head's coming out. And so, anyhow, basically how much the cervix is dilated indicates about how much longer it might be for the actual delivery of the baby will begin, okay, and how strong the contractions get. And they tend to get stronger and stronger as it gets more open. Now, the cervix is also we hear about because of cervical cancer. Cervical cancer is a fairly common cancer among women. Most of it, not all, but many of them are caused by human papillomavirus, okay, or HPV for short. Okay, very relatively rare for cancers to be caused by a virus, but this one is, and it can be tested for. A man had a longer name, I believe it was American, but I had a something, but I had a very long name, and they just shortened it down to Pap smear in his honor, named after him. But it's called a Pap smear, and usually this is where they swab around the cervix, and then they send it off to the lab, and I'm not sure if they check for the virus or exactly what tests they run on it, but that's used to detect the cervical cancer. And that has greatly decreased the number of people dying from cervical cancer because obviously the sooner you can pick it up, the sooner you can treat the cancer. And so usually late teen years or early 20s, when a woman goes in for an annual physical checkup, they will do a Pap smear, and that will be used to try to detect this cancer in case it shows up. All right. Now, there is actually a vaccine that has been developed called Gardasil, which is a 3-dose vaccine that prevents HPV infections. Okay. And at one time, they took making this a mandatory one for 12-year-old girls in the state of Texas. It's like all the other vaccine type things you have to get to attend school. But some people opposed it because they said, well, basically you're going to get the virus by sexual contact. If my daughter's not having unprotected sex, then this shouldn't be a problem, so there's no reason for her to have to get this vaccine. Okay. Also, there was some, in Texas at least, the company that made it was also friends with the governor at the time, and so there was some question about whether this was just an effort to help out his friends. The company make a lot more money, so it was eventually dropped. But so it's not a required dose, but it's still a vaccine. It's still available. It's for women, but it's also available for guys, and they recommend guys can get it because if they prevents them from being infected with HPV, then that prevents them to passing it on to their wife or whatever. Okay, so it can be for both men and women. All right. Now, the vagina would be the tube after the cervix. Okay, this is where intercourse would occur. This is where the penis would be inserted. Okay, this is where when the woman menstruates, the menstrual flow is going to leave through the vagina. And if the woman becomes pregnant during delivery, this would be the birth canal. So it kind of depends on what's happening, but that's what it's going to be. Now, going across the vagina before it enters is a thin, perforated, it has folds of mucosa that partially closes it off. Okay, so it's not completely shut down, and it has perforated, it has holes in it, and there's maybe even a hole in the middle where it allows like the menstrual flow to go out. Okay, it used to be that the hymen was considered a sign of virginity. If the hymen was intact, and the girl was a virgin. If it's not there, then she might not be. But to be honest, that's not very accurate because it's very thin. It tears easily. Riding a bicycle, riding a horse, doing sports, things like this could cause it to tear and may already be gone before the woman has sexual intercourse and still a virgin. So it's not a really good indicator of that. And occasionally it can be too hard and it will not break, and it may have to actually go in and surgically remove, but that's fairly rare. But normally it's a very thin membrane. The first time the woman has sexual intercourse, it would be torn and it would tear it away, and there'd be some slight bleeding because of that, but not particularly a whole lot. Okay, but it's not really as good an indicator of whether someone's a virgin or not. That's probably not very accurate. All right. Also, there are labia. Just technically means lip, but there's some big fold of skin, major fold of skin. This would be the outer fold around the woman's genital area, and it's fairly hairy, has a lot of pubic hairs and stuff on it, okay, on the outside. All right. Then there's another, inside of that is a thinner fold of skin that encloses an area, space, vestibule. Okay, the vestibule is just like a little open space where the vagina opens into, and the urethra or the urine thing is found. They're not connected to each other, but they are in the same little area there inside this area between these folds of skins. Okay, and so that's the labia minor. All right, and like I said, the labia minor, in there you have the opening for the urethra, and then behind that, or posterior to that, you have the opening to the vagina. All right. All right. Also in that area, you have the greater vestibular glands, and these are glands that produce mucus. All right, similar to the bulbourethral in guys that secrete mucus that lubricates the penis. These also lubricate the vagina during intercourse, so there's no rubbing and painful rubbing and stuff like that. So it lubricates the vagina for that as well, kind of like the bulbourethra does for the man. All right. Then there's a small piece of tissue called the clitoris. It's fairly small, but it's composed of erectile tissue, which is, if it swells up with blood, it will become erect, and it swells when the female is aroused. It doesn't have any other particular function, but that in some ways is kind of like the penis in that regard. All right, and that's kind of it for the vagina and that area. All right, so let's talk about conception. Conception is when basically the egg and the sperm meet, and we have a baby, and we have a fertilized egg, and the woman becomes pregnant. So let's talk about some things about that. First of all, gestation period. The gestation period is the time from the last menstrual cycle period to the time the child is born. If you do the math on that, that comes out to about 9 months. And 10 days, or give or take a little bit, depending on the months and how many days are in the months, okay? Now, since it's from the last menstrual period to childbirth, technically that would mean that when the egg was conceived, you might be some week to 2 weeks pregnant already based on that thing. But that's usually how they count it. Why? Because that's something that definitely, the date of the last menstrual period is something that you can kind of tie it directly to and then go from there, okay? Technically, of course, it would be within a day of the time the female ovulated, but you don't always know when that date was. All right. Intercourse must occur approximately 2 days before or 24 hours after ovulation. 2 days before, because any earlier than that, and the sperm may have already died out before the egg is ovulated and moving down the fallopian tubes. If it's more than 24 hours after the egg is ovulated, the egg is no longer viable or cannot be fertilized. So there's just a fairly tight window of about 3 days in there that the egg can actually be fertilized. Now, problem is it's difficult to know sometimes exactly when the female ovulated. Most women don't know exactly what day or whatever. It's hard to tell when they exactly ovulated, so you don't know for sure exactly when that is. Now, there are some methods of birth control that are kind of called the rhythm method, but basically they're trying to time it so that you don't have sexual intercourse in that time period, and then you won't get pregnant. The problem is, once again, because you don't know exactly when ovulation occurs, and so it's difficult to know exactly when that should be. And one of my instructors in college used to say that they have a name for people who use that method, and they are called parents. Okay, so it's not probably the most reliable. Now, if you were to broaden it by a week either side, then yes, you probably could do that, but it's probably not the most reliable way to do things. Okay. Sperm, once the sperm are coming in, they are attracted to oocyte. Oocyte, anytime you say oocyte, that's just cell. Site means cell. Prefix has to do with eggs. Okay, and there are chemicals that are released by the egg that are kind of like a chemical trail. So as it gets farther away from the egg, it gets fainter. So the sperm, if they pick up that chemical, then it starts to attract in that direction. And so it's kind of like a bloodhound on a trail. As they sniff it, they get closer and closer to the egg. It gets stronger and stronger. So that would be what we call positive chemotaxis, because there's a chemicals trail and it gets stronger, so you're attracted toward it. That actually helps steer the sperm in the right direction. All right. Now, once the sperm get there, the first sperm to arrive begin to break down and give off enzymes. And these enzymes digest the membrane. There's a membrane or corona around the egg that protects it, and it breaks that down. So actually, the sperm that first get there break down and start giving off enzymes that break down that shell. So it's actually the sperm that come after that actually get to enter into the egg and fertilize it. Okay, and that's called the acrosomal reactions. Those are the ones that break down the enzymes, digest that membrane. Okay, then one sperm enters the egg. Okay, once that first sperm enters the egg, there's some reactions that go on, and basically the egg will not allow any other sperm to enter, because obviously if you had more than one sperm, you'd have all these extra chromosomes, and the egg would not develop normally. Okay, so only one can enter. Now, once the egg is fertilized, we call it a zygote. And then as it divides, there's some different names for it as it divides, but basically it's called an embryo. And then I believe after 4 weeks, or is it 9 weeks? I forget. Then after that, it's referred to as the fetus. Okay, which is kind of a just technicality, is like when it develops to this point, but it's just the different names. So if you hear those different names, that's kind of what they refer to. All right. Now the embryo begins to form. As this embryo is forming around the zygote and it becomes an embryo, it forms what we call chorionic villi, which basically is little feelers and stuff that eventually will become the placenta that absorb nutrients and oxygen from the mom and take waste and get rid of it. And so this forming around this placenta kind of begins forming around the embryo, but it also becomes part kind of the endometrium, or the inside wall of the uterus. And so the placenta is kind of a combination of the uterus wall and what the embryo is forming there. Okay, the fluid sac around the baby is called the fetus. It's called the amnion, and